Hello, everyone, and welcome to today's Safety and Health webcast, Best Practices in Contractor Pre-Qualification, sponsored by Avetta. My name is Barry Botino, and I'm an Associate Editor with Safety and Health magazine. I'll be your moderator today. Thanks for joining us. In a few minutes, we'll start the presentation, but first I'd like to go over a couple of housekeeping items today. The views of today's speaker and organization are their own, and do not necessarily reflect those of the National Safety Council or Safety and Health magazine. Any mention of a commercial enterprise, product, or publication does not mean the Council or the magazine endorses those items. After today's presentation, we will conduct a question and answer session with our speaker. To ask a question, simply type it in the text box in the lower left-hand corner of your screen and click the button for Submit Question. Feel free to ask your question at any time at all during the presentation. You do not have to wait for the Q&A session to begin. We'll try to answer as many questions as possible today, but we might not get to every question. Any questions we don't get to, however, will be forwarded along to today's speaker. If you happen to have any technical issues during this webcast, please refer to our list of helpful tips on the right-hand portion of your screen. And for basic troubleshooting information, click the Help button located at the bottom of your screen. At the end of the webcast, you'll be asked to complete a brief evaluation survey, but I'll tell you a little bit more about that later. Avetta, our sponsor today, is offering several helpful resources for our audience members, which you can find by clicking on the Resources widget at the bottom of your screen. In addition, Avetta has made the slides available for today's presentation as well in that Resources widget. This webcast will be archived, so you can access it after today's live event. To view this webcast and all of our past webcasts, visit us online at safetyandhealthmagazine.com/events. With that, let's introduce our speaker. With us today to share his expertise is Tom Sisich. Tom serves as the president of TFC & Associates, a safety, health, and environmental management consulting firm, and as a strategic advisor for Avetta. Tom is a certified safety professional and a certified industrial hygienist. He also served as the 102nd president of the American Society of Safety Professionals and is an ASSP Fellow, which is the Society's highest honor. Again, we thank you all for tuning in to our presentation today. Tom, whenever you're ready, go ahead and take it away.
Great. Thanks, Barry. And hello to everyone. I'm joining you today from outside of Raleigh, North Carolina. I have my picture up here just so you have some sense of what I look like. I have to laugh. Some webinars actually have live video, and I try to discourage that. Number one is it tends to annoy me, and it probably will annoy you to have to look at me the whole time. So starting out, when we do programs at Avetta, we always start with a safety moment. And certainly with all of our experiences with COVID-19 right now, I thought I'd share just this slide talking about workplace hygiene and, the three areas of respiratory etiquette, hand hygiene, and avoiding touch points. I think most of us probably are in the process of returning to work or are certainly planning very seriously for it. And so these are pretty basic. So maybe the thought I'd like to leave you with as far as our safety moment is as you're looking at your workplaces and trying to reduce the risks and reduce the exposures, think about using the hierarchy of controls. That's a basic tool that as safety professionals we use, and most of us probably, think of it in terms of, physical hazards and chemical hazards, but certainly the concept applies to biological hazards such that we're dealing with perhaps in a unique manner now. So I'll leave that thought with you as our safety moment. Avetta has provided a number of resources. There's been a number of webinars we've done, white papers. There's a series of safety moments, one slide, presentation, just like I just showed. If you find those useful, you're welcome to use them. They're all free and available to you at avetta.com/COVID. A quick word about Avetta. We are a global organization with 450 clients that serve 95,000 suppliers throughout the world. We offer a technology and software solution for global supply chain risk management. We specialize in all aspects of supplier and contractor risk management, from pre-qualification, including auditing, all the way through the process to performance evaluation. If you'd like more information, please feel free to contact me or reach out after today's session. So today what we'd like to talk about are to discuss the importance and value of contractor pre-qualification, learn the key elements of an effective contractor management program, and understand the best practices for contractor pre-qualification as identified in 2 Campbell Institute studies. However, I'd like to start out with personal experience. And, if we're in this field, for a long time, we gather experiences that are particularly weigh on us. And in this area of pre-qualification, the one that really touched me personally started about 10 years ago, and I was just watching my local news, again in Raleigh, and there was a reporter who was doing a news story, actually an investigative report, about a double fatality in a manhole on a public works project in Durham, North Carolina. And think of an underground vault that was a collection tank. And what happened, what the story reported on, were two workers that were found dead in the bottom of this tank. And I thought it was, and I eventually spoke with the reporter and served as her technical reference, because I was just touched by the accident and the fact that the company refused to accept any responsibility for the fatalities. They denied workers' comp, said that the employees had no business being in the tank, and it just struck me as particularly egregious behavior. And but I got so far as to again be the technical resource. The fatality, I looked at the reporter asked me to look at the autopsy and explain asphyxiation due to hydrogen sulfide gas inhalation, which of course is a risk of underground tanks without proper testing. And the bottom line was that the city, and this is not unusual in public works projects and municipalities and state government, also has an issue, is very little pre-qualification is done, and most bids are selected solely on cost. And this particular case was listed in EHS Today magazine as the COSH, which is Committee of Occupational Safety and Health, which is a worker advocacy national group, listed as this fatality as one of their top 10 in most egregious in 2011. This was the article that was written. There's a misspelling in here, but that's the way the article was printed. But the bottom line, and you can look at the last sentence, it said the city of Durham subsequently is considering changes in their public bid process. And what those changes were is to do contractor pre-qualification and include safety as a key criteria in awarding these contracts. So this is really a case that sensitized me, and even though my company, and I've worked in electronics and chemicals and ultimately retired from pharmaceuticals, we were doing and had been doing various levels of pre-qualification, but again, it really raised to my attention the value and importance of and of course the impact ensuring that safety is a key criteria for selecting contractors, vendors, suppliers that you utilize. So the hiring of contractors presents benefits and risks. We do it for a reason, to do jobs that we may not want to do, that other organizations can do more efficiently. But we also have to understand that risks are introduced. And I suspect that many of us on this particular webinar, having been contacted through the National Safety Council, probably on the safety side of your businesses. And so obviously we're interested in safety performance, but things such as regulatory compliance, financial strength, quality, cybersecurity, insurance, sustainability, anti-bribery, the legal hiring practices and concerns about litigation and citations. These are all the risks that are introduced by making a decision to use third parties to help meet your business needs. And again, it's not to say that it's not a good risk to use third parties. It's becoming more and more common, as all of us know, but we should understand what those risks are and what are steps that we can do to minimize those risks. There's also a few changes that are occurring in the global environment. Many of you know that there's now a global standard, ISO 45001, Occupational Health and Safety Management Systems. That was approved in March of 2018. In the sustainability world, there's a Global Reporting Initiative, GRI 403, that was approved in June of 2018. And the interesting thing of both of these global initiatives, and we're also seeing it in the United States, is that there's a broad definition of workers versus employees. And more, we're seeing the term workers used as opposed to employees, meaning that if you're the owner, operator of a facility, more and more there's an expectation, both from a legal standpoint and a regulatory standpoint, that you take into account the safety and health of all the workers on your job. And workers means more than just your employees. It's anybody that's at that facility. And it's all the workers performing the work that is controlled by that organization, and it's whose workplace is controlled by the organization. So definitely we're seeing more of an inclusive. If a person's at your facility, you bear a certain amount of responsibility. Just to highlight, we are seeing that from U.S. perspective. Certainly OSHA, in their recommended practice for safety and health programs, there's a document for general industry and there's one for construction. It talks about the basic contents, which are most people will accept as a management safety management program. The elements: management, leadership, worker participation, which of course gains greater focus in recent years. Hazard identification, hazard prevention, education and training, program evaluation. Any management system has these key elements. But I think it's particularly telling that in both the general industry and construction safety and health program guide that OSHA put out, that they have as the last element, in this particular case, the general industry one, says communication and coordination for host employers, contractors, and staffing agencies. The bottom line is that they consider you having programs to ensure or minimize the risk to third parties as a key program element of your safety program. So I wanted to kind of give, before I jump actually into the meat of the presentation, kind of lay that out, that there's certainly a changing expectation of what your responsibility as a host employer is the people that are working at your facility. I'm going to use 3 references for my talk today, and 2 of these are available online, and the other I can get you access if you'd like. I'm sure our colleagues at the National Safety Council will be pleased to see 2 of these are publications from the National Safety Council's Campbell Institute. And then the third is one from the American Society of Safety Professionals. And I'll make reference to those throughout the rest of this presentation in terms of their references to pre-qualification. The first step we should look at is before we talk about pre-qualification specifically, is look at the contractor life cycle. And for contractors, working on a job, or vendors where they have, specific responsibility, generally there's 5 distinct areas or periods that are involved in the life cycle. The first is pre-qualification, which is where we're going to spend the most time on our discussion today. So pre-qualifying the people that are going to be the third parties that are going to be doing the work at your facility, and that may be whether they're there for a 1-week job, or really assume, I won't call it a permanent responsibility, but a long-term responsibility, such as a facilities maintenance group or a logistics group, or a cafeteria food service group. So whether they're short-term or long-term, pre-qualification still is a key element. The next step, pre-job task and risk assessment. Looking at the work they're going to do and looking at what the risks are, both that they're introducing that might impact them. Now, you're hiring for their expertise, and you should expect them to be able to identify what the risks that their people are going to be exposed to. But you have to understand it's a broader question, because they can introduce risks not only to their workers, but also to your workers. So it's important that you understand, or define clearly what their jobs are, and to the extent that you understand the risks, to communicate those to the contractor so that they understand, the risks that they're being introduced to at your facility, and that goes both ways. That they should be communicating what risks they're bringing to your facility. Training and orientation, of course, is a key element. How is that done? Who does it? And how do you track it to ensure, particularly if you have a contractor that has different trades coming in at different times, or experiences higher levels of turnover, how do you ensure that the workers that are on your site, and again, I use the term workers, which then offers that you have some responsibility in the overall management of safety of your facility. The fourth is the monitoring of the job. Is unless there are very, very few circumstances where you can assume a hands-off position and say, get the job done and bill me when it's over. Now, you might argue that some greenfield projects that can fence it off and not introduce any specific risks to your operation. I think even that, to some extent, probably is not completely true also. So, you have some responsibility to monitor that work as it goes. And the fifth step of the contractor life cycle is the post-job evaluation. How did we do? And I'll talk a little bit more about this, because we're going to see that in listing some of the the challenges that many companies have is they don't do a very good job or any job at the post-job evaluation. And I think there's an argument that says that you may not have a better opportunity to gain information or to learn for the future by doing these post-job evaluations. Now, I'm going to refer directly to the document from the Campbell Institute, and they list looking at best practices and common challenges. They list a series of best practices that the Campbell Institute companies who developed this publication have found from their experience to have the most success in working with contractors, suppliers, and third parties. So, and I will go through some of these in a little more detail, and certainly the pre-qualification. So, step one, the Campbell Institute member companies found that the use of third-party pre-qualifying companies is a best practice. Now, honestly, that may sound a little self-serving since that's what Avetta does, is a third-party pre-qualifying company. But again, the companies have found that the pre-qualification process is evolving. It's getting more robust. It's getting more thorough. And those companies that are doing it well, or they think they're doing it well, and these are very famous companies that we all will have heard of, best-in-class companies, that 71% of those, almost three-quarters, use a third-party pre-qualification company that uses a well-documented resource, well-resourced, and risk-adaptive vetting process. So, and I'll be clear, and I don't want to come across as shameless advertising for Avetta. In terms of the pre-qualification, there's no reason that your company, your organization can't do your own in-house. It can be done. Certainly has been done for a long time, but just as this slide indicates, the level of scrutiny continues to expand, and the third-party companies are have processes and technology to help you with your pre-qualification process. Once again, you can do it in-house. Just understand there is a cost to it. Neither approach is a free cost, is free. And if you choose to do it in-house, just ensure that you have adequate resources available to do the elements of pre-qualification. And resources include people time and also technology time. Just remember, you will be competing just as you compete for any IT resources. It's always a constant struggle because everybody wants more technology to manage their, to simplify the management of their operations. Same thing applies. So if you're trying to get in line for technology for pre-qualification, just recognize that you're going to have to build your business case as to why it's more important for your company to use those resources for pre-qualification versus production scheduling or some other type of business operation. At Avetta, we've tried to put together what we think is a cost justification. If you did this in-house, these are the various tasks that you would need to do to effectively vet a contractor. And you can see the numbers. I mean, we can debate, whether it takes 1 hour or an hour and a half or 3 hours or half an hour for each of the elements. But what we found looking across the number of different clients is that roughly 12 hours per contractor per year to appropriately vet and follow And remember, things change in contractors. It's important to keep track of changes in their safety performance, changes in their insurance requirements, changes in their, if you follow their EMR rates. It's very important to keep track of that, which it's not a one-time perform the task and then forget about it. So roughly we found that its total hours per contractor are 12 hours a year per contractor, which, if you work on a 2,080 work hour a year, that would equate to about one full-time staff member responsible for pre-qualifying, monitoring, and keeping track of the various elements of contractor management. So you can do the math as to what you would either be paying or what the best-in-class companies are, the amount of resources they're using if indeed they're managing it in-house. And one other, I want to refer to the other Campbell Institute publication. It's called Making the Case for Contractor Management. And they actually went through and took data from one of the third-party providers, pre-qualification providers, and they looked at the data of injury illness data, and what it showed is that the gray bars on these, using OSHA data and of course using experience mod rates from an insurance standpoint, the gray bars are the industry averages. For EMR, the gray bar would equate to 1. But the gray bars are the industry averages. The green bars were the averages for those contractors and those industries that had gone through the pre-qualification process for that third-party vendor. And you can see that those companies that had gone through the rigorous pre-qualification process, their performance on site, and this is their site performance, is considerably below, generally 1/2 of the industry average. So you should expect, however you do pre-qualification, that you're getting the best of the contractors, the vendors, the suppliers that you're looking for to do those jobs. By holding them to high standards, you should get better performance from your contractors. The other interesting thing was, in the Campbell Institute study, was not only are the contractors better overall, if you look at the data, comparing the average of a particular, say, trade to the industry average of that type of trade, but that the performance also improves further over time. So not only are the clients that use this particular third-party company, which in this case is Browse, full disclosure, Avetta purchased Browse last year, but the Browse data was used several years ago on this study. Not only do the clients, the contractors and suppliers, the clients, or the Browse clients were using, not only are their rates 50% of the industry average, but those that had been using the process over a period of years, the performance of those contractors continues to get better. So I think that was the conclusion, the concluding statement from the report. It said the use of third-party contractor management systems can be considered a best practice for all companies using contractor services. And again, to be fair, that the processes that are used, you can replicate if you choose to do it on site. Just understand the level of resources, in terms of finances, people, and technology that would be required to do that. So, going back to the other Campbell Institute report on contractor management. These continue to be the best practices, and I wanted to run through these. The second best practice is let me just jump back a slide, assessment of contractor safety statistics. So it's a best practice for contractor pre-qualification is indeed knowing what the safety outcomes, what the lagging indicators, if you will, of the contractors that you're going to use. And we can debate and should debate whether, is that the best metric. We have those debates within our organization about lagging and leading indicators. But in a study in Professional Safety magazine, the portion of safety professionals rating the proportion of safety professionals rating the importance of evaluating contractor injury history during pre-qualification, and you can see that the vast majority, close to over 75%, feel that having this data and tracking this data and evaluating this data is of significant importance in your pre-qualification process and your monitoring process. It's important to, particularly on a project that might be multi-year, it's important to know, are there changes that are occurring for either better or worse? Ideally, you'd like to see improvement in the numbers. If they're not getting better, if insurance costs are going up, that's certainly an indicator. And again, we can debate, the merits of leading versus lagging. There was a July 2019, sorry I didn't put the date on here, professional safety article. And I remember when it came out, it caught my attention. It was called Contractor Safety Prequalification. And the author is David Will Banks. I believe he is at IUP, Indiana University of Pennsylvania, is on the faculty there. He raises some very good concerns and arguments about relying solely on the use of lagging indicators. And, he identifies three concerns. Number one is that in many cases contractors are small, and one event may significantly skew their overall performance. And so that's, looking at numbers alone, and I have a slide that illustrates that next, may not be the very best way to evaluate it. Certainly there's a concern about underreporting of information from contractors. Contractors understand that if your organization sets a firm bar at, say, total case incident rate of 2.0, if they exceed that, they're not even going to get on the bid packet. They're not even going to go any further on the pre-qualification process. They understand that, and there's certainly, and I've heard this many times from contractors, talking about the challenges they have and the pressures they have, in terms of the reporting of accidents and, the classification of accidents that ultimately they would have to report. So that's a real problem when we're using injury illness data. And then the inability to audit that data, or the unwillingness, or not being able to look at their injury illness data at a granular level and say, are we really looking at correct reporting? And in his article, the July 2019 article, he gives a hypothetical example. And say the hiring organization has 100 employees and they have one injury or illness over the period of the year, they would have 200,000 hours worked, and they'd have an incident rate of 1.0, which obviously is very good. And, so they might look at, if they're evaluating a small contractor, they might look at their own data. They'll look at the national average for construction workers, which would be 3.6. And then, just look at, the various contractors, a contractor with 10 employees, 16 employees, 22 employees. One injury, blows their incident rate out of the water. And so if you're looking at numbers alone, you might say, well, we're going to exclude contractor ABC and not use them. And without knowing, what kind of injury did they have? I mean, did somebody, cut their finger on a sharp edge, or, did they fall off a ladder? Looking at, their work practices and processes. So, the argument for using just the numbers is just recognize that there's limitations. Just like within our own facilities, looking solely at lagging indicators and trying to say what's that going to, predict for the future. We understand that, what do they say in the finance world? Past performance is no indication of future performance. If the financial and the stock market and the financial analysts understand that, that's a principle that we should also understand. So moving on, the next would be internal scale or checklist to assign grades to contractors during pre-qualification. In other words, we're still on best practices. So have some measurement in addition to assessing and tracking the injury illness. Look at what they're, look at other metrics that they show. And in Will Banks's article, once again, he recommends a number of different pre-qualification metrics that you may want to look at. And some of these aren't going to apply in every work environment. But the bottom line is don't just look at the safety program and the safety outcomes, but what is our overall program? What are the various program elements of training, certifications? Have they done your type of work before? What is their liability and regulatory history? What is their capacity to do the work? If you look at it and say, this job really requires highly skilled, tradespeople, and you're looking at the backgrounds of the people and you're going, I just don't see it here, chances are the work's going to have problems. Look at their ability to pre-task and pre-job plan. What does monitoring show? And then ultimately the post-job evaluations. I go back to the fatality investigation that I referred to early in the talk. And the company that ended up doing the work, and it was a fairly big public works job for the city, if you looked at their record, whether it was injury, illnesses, whether it was their regulatory record, whether it was their insurance, EMR, the numbers, from a safety and health standpoint, and it was, heavy construction work, they were not good. They would be very low on a comparison of looking at a number of different companies. And, but again, because it was, everybody knew it would be a low bid job, there were only certain companies that decided that was the kind of work that they were really interested in. So, the broader you can look at the amount of information that's available, the better indication of what that company is going to bring. The third element, or another best practice, is risk rating for work to be performed by the contractor. What are the risks associated with it? How are you evaluating those risks? If you look at it and say, this is we're bringing in experts to do this. This looks like a pretty risky lift. What's their ability? How are they assessing the risk? How are they going to do the work? to minimize the risk to their operation, to their people, and your operation. Another best practice, placing general contractors in charge of subs and holding them to the owner's safety standards. What is it? What are the standards that you're going to require? And hold the general contractors responsible for ensuring their subs meet those standards. Another best practice is verification of contractor certifications, permits, ensuring that that for subs that the site safety orientations get completed, and then periodic scheduled assessments during the contract term, looking to see how are we doing during the period that this work is getting done. So these are the best practices and challenges associated with contractor management by the member companies of the Campbell Institute that participated in this particular study. And even they recognized that there were common challenges among these best-in-class companies in terms of contractor safety management. Most of the companies recognized that these were some of the limitations that they were facing. Number one is a formalized structure for disciplinary action. How do you deal with with contractor vendors that aren't performing up to their own your specifications or their specifications for that particular job or for the particular performance measures built into those jobs? What's the formal structure? And companies are reluctant to terminate contracts for jobs that are halfway done, and there's very good reasons for that, of course. There's legal issues, there's cost issues, but it also introduces significant risk to your organization and risk in terms of the job, not just for people getting hurt. There's cost risk and completion risk, safety risk. Another challenge is there was very little integration of contractor lagging metrics into owners' safety statistics. And you might say, well, why do we have to do that? OSHA doesn't require that, and that's a fair point. But as I indicated early on, certainly with some of these international standards, whether it's ISO 45001 or the sustainability reporting requirements, more and more people that are interested in overall organizational performance, and many times that for publicly owned entities, that includes the investor community. They want to know what's occurring on your site. What are the overall risks associated on your site, and safety being one. And to them, it's somewhat transparent whether the safety risks are from your employees or the safety risks from contractor employees. So the Campbell Institute companies understood it's a challenge, but it's important to be able to take a holistic view of the injury performance on the facility. The last point: lack of formalized post-work evaluation process. Again, companies struggle. Most organizations are happy that the job is done. It's been completed. Might be on time, might be under budget, and so there's a rush to commission the project, get it started, and move on. There's a lot of lessons to be learned by looking at a post-job evaluation. You can have an additional layer of risk evaluation. How did we do? What was how did the qualification process go? Was there can we reward superior performers? Can we understand what worked and what didn't work? It's interesting that sometimes we have clients that actually use this process as a 360. Not only do the clients talk to the suppliers and contractors and say, here's how this went, here's what you could do better, next time around let's do this, but it's also an opportunity for the contractors and vendors to tell the client, what they could do better. How can they help the contractor, the vendor, supplier, to be more effective in how they're doing the job? Sometimes we put a blinder on to what our responsibility is in some of these jobs, having challenges. So, but what I found interesting is that, again, the best-in-class companies almost all recognize that the ability to evaluate performance, post-job evaluation, was a challenge and an opportunity for them. So in terms of just a couple thoughts on pre-qualification, and again, I don't mean this to be selfish advertising for Vetta's part, because we are a technology company, we offer technology solutions, but take advantage of technology either through a third party or internal. Look at, do you have the ability to look at the data broadly, to use analytics? Can you configure your requirements? Can you use technology to streamline the process? And can you get your suppliers to enter data? Help, get out of the data entry work to the best you can. Now, you're going to have to vet your data, vet what they put in, but a technology solution will allow you to gather large amounts of data and then hopefully analyze that data. And it also allows you to measure and track your approvals in real time. Where are you? What needs to be received from the vendor, supplier, contractor? Is that data, does it meet your expectations? And if so, if not, why? And this is something that they can correct. This is not a, pre-qualification is not a black-white. You pass, fail. You're in or you're out. You still have to make management risk-based management decisions. And so you need to take advantage of that, and technology allows you to do that. There was an article I cut out of Forbes magazine I found a few years ago that I saved, and I applied it in a number of different areas, certainly in my work with Avetta, but elsewhere also. And it talks about, the title was Digitize or Die, and it was called The 4 Superpowers of Technology. And the 4 superpowers are the cloud, mobile technology, the Internet of Things, and artificial intelligence, AI. And in your contractor safety management program, certainly your pre-qualification program, if you're going to follow best practice, you're going to generate a lot of data, particularly if you're a large company, you have a number of suppliers, vendors. So again, I think having a technology, the technology to help you manage your process is critical, whether you provide it in-house or whether you contract through a third party to get that data. So in conclusion, the references that I've referred to in this presentation, there are 2 from the Campbell Institute, and of course you have access to these slides, but you can download those reports directly. And the other I referred to was the professional safety article in July of 2019. If you're a member of ASSP, you have access. If you're not a member and you'd like to have that article, reach out to me and I will ensure that you get a copy. So with that, I think we're targeting to allow 10 minutes for questions and answers. Here's my contact information. So, Barry, I will turn it back over to you, and we can go through we have about 10 minutes to go through some questions.
Well, thank you, Tom. A great job today. Thanks so much for sharing all your insights on this topic. Remember, folks, if you'd like to ask a question, go ahead and simply type it into the text box in the lower left-hand corner of your screen, and you can click the button for Submit Question. I want to remind everyone of the evaluation survey we're asking you to complete today. The survey should be appearing on your screen right now. Your feedback is really important to us because it does help us to improve our future webcasts. If you don't see the survey on your screen, go ahead and turn off your pop-up blocker, please. You may also access the evaluation by clicking the survey button near the lower right part of your screen. And I also want to remind everyone, make sure you check out all the resources that Avetta is offering today at that resources widget on your screen. The slides from today's presentation are also there. And let's go ahead and get to some questions, Tom. And the first question I have for you is obviously something that's on everyone's mind, is COVID-19. And one of our attendees asks, how does the COVID-19 pandemic change the contractor pre-qualification process?
Well, of course, the challenge that we all have is anybody that's at our facility, introduces additional risk. And the contractors, as much as we'd like to have, as much control as we'd like, or as much control as we have over our own employees, which, in and of itself presents a challenge. I mean, we're all, plowing new territory here, I'm afraid. But you should expect, if you're looking to use a new contractor supplier, or if you have one that you're already using, you're trying to bring them back, to support your operations, is the same principles of isolation, protection, all the CDC recommendations and OSHA recommendations need to be followed. So you need to have a system, and from a pre-qualification process, that can become part of the decision process, whether the organization you want to bring in on to do the work during this time is sufficient, meets your requirements. So questions associated with what is their what is their preparation, what are their controls, how are they addressing the COVID-19 precautions with their employees. So there's really no difference, but you can use that as a pre-qualification requirement that says, or a criteria, I should say, that says, we're going to evaluate their program, and both on a pre-qualification basis, but also on an ongoing, because they get loose with their criteria for letting people on your facility. It just opens you wide up, to have the virus impact your employees and your operations. That's a great question. Unfortunately, we're all kind of muddling through it together, and the use of third-party contractors, suppliers, just adds to the challenge.
Absolutely. Tom, our next question, one of our audience members wants to know, is there a risk transfer benefit for conducting a third-party review versus an in-house review, i.e. less liability?
Well, again, what you're trying to do, there's a number of risks associated with using third parties, whether it's contractors, vendors, contract manufacturers. In the Avetta world, we deal with people that would be referred to as contractors or vendors, or various aspects of supply chains. And you have to understand that you're introducing, the further you get from your direct control, you're introducing liability, you're introducing regulatory issues, you're introducing the potential for bad publicity. You're introducing the threat of continuity of operation. So and those are all risks. Those are all risks that your management, by saying we're going to use a third party for this job, your management has accepted those risks. Now, I would argue, and this is from my own past experience, I'm afraid that a lot of times the people making the decisions, because of lots of filtering or lots of focus maybe on cost alone or customer demands, that some of those risks that in the health and safety world we might think are significant don't get evaluated very well, or aren't raised to a high enough level for visibility. So again, it's important that there is a little bit of transfer of risk, particularly where you're asking an organization to take on a risky job, either because you don't have the expertise, you don't want to assume that risk. Things such as crane operations. If you're in a manufacturing plant, that's just not a skill or a capability that we have. We contract it out and so there's a lot of operations like that. So we do transfer risk. But in that transfer, and there's nothing wrong with that. I think it's a challenge if I know of organizations that have transferred dirty and high-risk jobs to organizations that outside of a quick pre-qualification review on paper, most people might say there's no way that this organization can do this job safely. And if you have people saying that about a risk that you're transferring, you're making a bad business decision, because it will get you. And so there is a transfer. I think that it's important that everybody in the organization, your organization, all the different people involved in that decision-making, whether it's procurement or engineering, safety and health, quality, operations, finance, all the different, elements of your organization that have that are stakeholders, understand what the risks are and what steps are built in to mitigate those risks.
Okay, thank you, Tom. We have a question here from our audience. Are partially exempt contractors required to provide OSHA performance data into these systems?
Well, my big question. I'm not sure what a partially exempt employer is. So maybe there's a gap in my knowledge. So let me try to answer the question, which it might be the wrong answer to the right question, the right answer to the wrong question. I'm not sure. It's your call as to what data you want to collect from your organizations, and ideally you want to standardize it so that the organizations that are reporting, your vendors, suppliers, contractors, are all reporting the same type of information that you want to that you need to make decisions on. The key and the use of any, let me address just the use of a third party, just like if you were doing it internally. At the end of the day, you have to control the decision making. The third party doesn't control whether you accept, and let a contractor or a third party on your facility. The third party will tell you, have they met your requirements? You say, I want them to have a 2.0 injury rate, no more than a 0.95 EMR, no, willful OSHA violations, certain levels of insurance required. You define all those requirements. That's your call, and you advise your third party, here's what we want you to determine about all the contractors. Well, at the end of the day, the third party may come back and say, this company meets all, but, instead of a 2.0, they might have a 2.5 incident rate. It's your decision, ultimately, to decide whether that contractor comes on site. So all the third parties are doing is giving you an evaluation based on your criteria. They will tell you how and monitor it and track it and verify it. They'll do all those things, an extensive amount of, support for you. But, at the end of the day, it is still your decision. Even if they don't meet your requirements, you might have unique, issues. You might have timely issues. You might be out in the middle of nowhere with a facility and only have one vendor, and you might need to introduce additional risk management, methodologies to mitigate the risk from that vendor. But even though they don't meet your base requirements, you may still make a business decision to do that. And the key there is that everybody's on the company side, everybody's on board and gives a thumbs up and says, we can make this happen with this level of risk mitigation. Barry?
Great. Well, thank you, Tom. I do appreciate that answer. And unfortunately, we have run out of time. I'm sorry we didn't get to everyone's question today. But remember, all of today's unanswered questions will be forwarded along to Tom. And once again, I hope you take time to fill out the evaluation survey on your screen to share your input about this presentation today. And that ends our Safety and Health Magazine webcast. I'd like to thank our outstanding presenter today, Tom Sisich, everyone from our sponsor at Avetta, and all of you who listened in today. Have a safe day, everyone.
Thanks, Barry.